The festive season is fast approaching, but China is facing a return of COVID-19. There are over 26,000 new cases in parts of the country. Government has shut down a number of businesses and schools in hard-hit districts. South Africa has relaxed most of its COVID protocols. Is the country ready, though, for a return of the deadly virus? Well, health expert Dr Fundile Nyati weighs in on this. Doctor, good morning, and thank you very much for your time. You know, we keep monitoring China's numbers. It's almost as if it's another world for us. Their numbers are just soaring. Beijing is closing down schools and businesses. But what can we make of this? Because many people are thinking perhaps we should be worried.
Well, if we just go back and remember that this, COVID-19 pandemic started in China, at the end of 2019, beginning of 2020. So when we see the numbers going up, I mean, on Sunday, they had just over 26,824 new cases in the whole country. And they had 3 deaths, in the weekend, So that hasn't been the case. I mean, the last death they had was in the end of May. So when we see that kind of, picture emerging there, we must start to worry, because when the pandemic started, we thought it's something that's far away. It took 3 months for it to get here. But this time around, we are actually in South Africa having our own increase in the numbers. So we can't be complacent, In the last 4 weeks, based on the reports from Department of Health, we've had close to 10,000 new cases in the last 4 weeks here in South Africa. We've had at least about 138 deaths in the last 4 weeks here in South Africa. So what is happening there? We mustn't think it's something that may not be able to happen here, because we are having a problem.
What of those that say, with the benefit of hindsight, perhaps China this time around would be able to better contain it in just their state, that it would just remain there, so that's why some of them are not even all that worried?
Well, I wouldn't agree with those people. Why? Because China has been using its, its zero COVID-19 policy, which is quite draconian. And they have not really been able to stop this, to a significant. Yes, they didn't have the amount of deaths that America and other countries in Europe had, so they contained it a bit. But right now, they are struggling with a number of flare-ups in different parts. I mean, in one of their cities, Guangzhou, is battling, this outbreak. So it is not really working for them. And they are changing their tactics a bit slightly now, where they close up those suburbs or areas where there's a high number, of people who are infected in that community, compared to when they just used to close the whole province. So they are trying to change things and do it slightly differently, but I don't think they are winning. And if I take that and bring it here in South Africa, we have dropped all the measures really. And I think we're quite complacent at this moment. Vaccination levels are very low. I mean, less than 500 people yesterday actually vaccinated. Yet that is one biggest tool we have against, people getting to be hospitalized and even dying. So the point I'm trying to make is that, what we're seeing there may well happen here in South Africa. Unfortunately, we are now, I think, less prepared in terms of the public is less prepared in terms of, this pandemic. And when it comes back, it's going to be trouble, because most people are no longer vaccinating. And those who are vaccinated haven't had their boosters.
What do you make, though, of our response or our attitude to COVID right now as citizens? Because many of them do not want to hear a thing. Is it that they've been so traumatized, they've lost so much, and our economy was so battered that there's just this, perhaps, desire to almost block it out, as if it's something that has not happened?
Well, you're right that quite a number of people have been traumatized. I mean, even if there was no death of somebody that is close to you, but the truth of the matter is that, just being locked in your own home for months on end was trauma on its own. But the loss of lives that has happened has been a big problem. But we are at a point where we feel like, you know what, we must enjoy life. Get December, December is coming and people just want to have, the good time. But the problem is that the virus is not gone. And with the virus not gone, we're still going to see more people dying like the 138 that have died over the past 4 weeks.
And that's why some are saying we've got to take a leaf out of the second biggest economy's book, because China is a serious economy. And if they've decided to go this draconian route, perhaps we should be taking note of what they're doing or how they're responding and their consistency on just monitoring COVID.
Yeah, I don't think we must be as draconian as them. But let's get people to know that this thing is still there. Let's get people to vaccinate. And the truth of the matter is that the Omicron version that we have now isn't as deadly as the Beta and the Delta that caused a lot of deaths before. But that doesn't mean we must not, take, measures to protect ourselves. So I think a bit of balance, not too draconian as China, but not, too laissez-faire like we are doing at this moment. So something, in between. And let's keep the conversations going, because people, they no longer hear much on TV, on radio, and everywhere, and they think this thing is gone, and it is not gone.